My name is Glenn Ault. I am an associate professor here at the Keck School of Medicine in the Division of Colorectal Surgery. I am the program director for our colorectal residency, and I see patients here both at the USC campus as well as the LAC USC Medical Center. So it's incredibly important that we train the next generations of surgeons in our program here in Los Angeles. Certainly, as folks finish general surgery residency, they come to us for an additional year of colorectal training, and we want to train them in the latest techniques in colorectal surgery, how to do oncologic operations, how to be competent in all of the various procedures that we do as colorectal surgeons. We have the oldest training program for colorectal surgery here on the West Coast, here at USC. We have trained over 80 residents since the program started back in the late 80s, and I'm proud to be the program director now. So certainly the evaluation of our educational process has taken a forefront, not only here at USC, but in the nation. And as we have looked at various ways to measure competence, whether that's in the operating room with technical competence or using the ACGME milestones for medical knowledge and patient care, there is a vast array of evaluations that we use that not only look at simple things as book knowledge, but also can you technically perform an operation? We have expanded into the use of video evaluation of procedures with a technological explosion that we've had, especially with laparoscopy. We're able to use video to critique operations after the fact. Our colorectal program here at USC maintains a full accreditation status for 10 years. It's the longest accreditation that the ACGME bestows upon a residency program. Colorectal education has clearly evolved in recent years, and the future is very bright. We do various things that we didn't do 10 years ago, for example, or even 5 years ago in how we train residents, how we evaluate them. We use video, for example. Here at USC, we also have the opportunity to have a fresh tissue cadaver dissection lab that we can take residents into and use those cadaver models to teach operations and train residents on complications and tricks of the trade, if you will, to train them better so that by the time they get into the operating room, they are in a much better place educationally. We also have a simulation lab. It was one of the early simulation labs here on the West Coast as well that we use not only for our students, but for our general surgery residents as well as our colorectal residents to train them in procedures and how to use the instruments and the technology that we have available today before they're working on a patient. The Milestone Project, which was initiated by the ACGME, is a series of evaluation tools that we use as educators to evaluate residents in areas that are specific to our specialty of colorectal surgery. We identified 9 milestones on a national basis that really are diseases that colon and rectal surgeons manage as compared to, say, a general surgeon. These 9 areas have been developed, and it's a tool that we use to evaluate the resident. The resident can then use that tool to know where they are at on the continuum of education or where we expect them to be at the completion. The ACGME uses it as a measure of evaluation of our program, and ultimately they would like to use the milestones as a way to show the public who funds graduate medical education that we're actually teaching residents the things they need to learn. Here at USC, we have a comprehensive education program that involves several facets. The cornerstone of the program is our ACGME residency, where we train 2 residents a year in colorectal surgery. The other components include the opportunity for research fellowships, as well as our anorectophysiology fellowship. In the anorectophysiology fellowship, the trainee is able to learn the aspects of anorectal manometry, physiology, as well as endorectal ultrasound, and then be able to apply them in the clinical arena. One of the other great aspects of our training program here is our public-private partnership that we have with the County of Los Angeles. We provide the colorectal services at the Los Angeles County USC Medical Center, the General Hospital of Los Angeles County and the cornerstone of their health system here in Los Angeles. That educational venue allows for graduated responsibility of our residents. It allows us to see complicated advanced disease that we're not usually seeing in other areas that our program covers. The patients that we see at LA County USC Medical Center often, in many cases, do not have routine access to medical care. So it provides our trainees an opportunity to see diseases, sometimes in their advanced stages, and how you manage and treat those patients.